Shocked. Absolutely shocked.
When 52-year-old Becky Quinn was diagnosed with breast cancer 3 years ago, like so many other women, she says she couldn't believe it.
Mother had breast cancer, but she's 90 and healthy, living today.
This is the cancer.
You never think it's going to happen to you. You think that, you know, I'm healthy, I'm fine, and this is not going to happen to me.
Hi, Becky. But according to the American Cancer Society, Quinn was at high risk. That's because her mother had suffered from the disease. If she had made the connection 3 years ago, she might have had a different type of screening that might have caught the tumors earlier.
I would have had a breast MRI, which potentially could have avoided surgery, chemo, and everything that I've gone through.
A new survey from Washington Radiology Associates is finding that there are a lot of women like Becky Quinn who have no idea that they're vulnerable to developing breast cancer.
What we found out was that less than 3% of our patients actually knew their own personal risk of developing breast cancer. And it seemed that in this population of very sophisticated and knowledgeable women, that seemed like it was just really off.
Radiologist Dr. Ott says the American Cancer Society changed their guidelines more than 2 years ago, recommending that women who are at high risk should get a breast MRI along with their annual mammogram. But women still weren't coming in, and that was cause for concern.
Where is their risk getting assessed? Where are their doctors doing this? So the results showed us that they actually don't know their risk, and that's why they're probably not getting their breast MRIs. This turned out to be the breast cancer in a woman who had a normal mammogram and a normal ultrasound.
And according to some new research, breast MRIs can make a big difference.
Mammograms are great, but they're not perfect. And it has been proven in clinical trials that the most sensitive tool for detecting breast cancer is the MRI.
But these types of screenings can also find false positives, leading to unnecessary anxiety and further invasive testing like biopsies. That's why MRI is only recommended for those who are at high risk for developing breast cancer. The American Cancer Society has found that these patients include women who have certain gene mutations, a first-degree relative like a parent or a sibling with breast cancer, or those who have been treated with radiation to the chest between the ages of 10 and 30.
Women can now really understand their breast health situation in a way that I wish I did 3 years ago.